So a little bit about the scene. You are being dispatched to a cabinet making shop for a traumatic injury, and the patient is a 27-year-old female. So hi guys, my name is Jose. I'm an EMT student. My assistant is gonna be Camila, my little sister, and we're gonna go and jump right ahead. So first of all, we need to check for PPE, and right after that, we're gonna make sure that the scene is safe. So is the scene safe? Then we're gonna go ahead and check for the mechanism of injury. In this case, our patient is gonna let us know that she was in a bandsaw accident. While she was using a bandsaw, she accidentally slipped and her arm got caught in the saw. So that seems to be our mechanism of injury. Then we're gonna go ahead and assess if this is our only patient, which it seems that yes, we only have one patient. Right after that, we will check for, or I will make sure that I call for extra EMS support as necessary, or ALS. Then we're gonna check for C-spine. Since the patient seems to be alert, she might not need it, but we're still gonna make sure. So I'm gonna tell my assistant to stabilize the C-spine. Then we're gonna jump into our first survey, which we're gonna determine my original, what I think of the situation, my personal assessment, which is that the patient seems to be alert, she's conscious at least, and her injury does seem to be severe, as the rag she's holding over her hand seems to have a lot of blood. Now we're gonna go ahead and determine the level of consciousness with the AFPU scale, and so the proctor is gonna let us know that she is alert, and after that we're gonna determine. So we're gonna determine the chief complaint. The chief complaint obviously seems to be that she suffered a laceration in her arm with a bandsaw. Then we're gonna go ahead and go into ABCs. So we're gonna assess the airway. So make sure that there's nothing in her airway. Is her airway open? All right, and we're gonna make sure that she's breathing correctly. We might even want to take some palpitations, auscultations, so we could put those on. Check for breaths. And is the breathing normal? Then we're gonna go, or before that, we might want to administer some oxygen based on our findings. So we're gonna have my partner administer oxygen via non-rebreathable mask at 12 to 15 liters per minute. Then we're gonna go ahead and check for circulation. So first of all, we're gonna try to control the bleeding. So since the color of the blood is bright red blood, I'm gonna assume that she has suffered damage to an artery, which is gonna let us know that she's a high risk patient. So this is gonna make us call for immediate transportation. Then we're gonna go ahead and put pressure on that wound, and hopefully it'll stop bleeding. If it does not stop bleeding, then we're gonna want to apply a tourniquet above the joint of the affected wound, and also we're gonna want to check for a radial pulse. Make sure that we have a pulse there. So what would be the pulse? All right. So the last thing we would want to check is the skin. So we want to check for the skin. So what kind of conditions does the skin have, or the temperature of the skin? So what would that be? All right. And so based on the pulse, based on the injury mechanism of injury, and based on the skin, we might fear that she's going into hemorrhagic shock. So we're gonna transport immediately. And after that, we would want to take vital signs. So what would be my vital signs? And also, we would also like to take a sample question since the patient is alert. We are able to take those. We are able to take that history. So signs and symptoms, any allergies, any medications she's taking, any past medical history, and the last oral intake, and we're gonna talk about the events leading up to the event, the events leading up to this to the injury. All right. All right. So then we would hop into our secondary assessment, and that is gonna consist of doing a full body inspection. So we're gonna go ahead and palpate the head, make sure we don't have any cranial injuries. Then we're gonna look at both ears, make sure there's no liquid coming out of them. Then we're gonna look at the eyes, are they equal? We're gonna look for that pearl or perla, and then we're gonna make sure that nothing in the face is wrong. We're gonna check C-spine by touching the back, the cervical spine, making sure nothing's wrong with that. We're gonna look at the for JVD, jugular vein distension. Then we're gonna check the trachea, make sure the trachea is not deviated. Then we're gonna go ahead and palpate the chest, make sure there's no chest injury, or look at the chest before we palpate it. And then we might even want to osculate, which gets some breath sounds, make sure that we don't have any problems going on with the lungs. So we would check that. All right. Then we're gonna go down, move to the abdomen. So we're gonna check the abdomen. Check for any tension or any tenderness, maybe any possible pain. All right. Then we're gonna go down to the pelvis. Check for the pelvis. There's no pelvic injuries. All right. Then we're gonna go ahead and move down to the lower extremities. So we're gonna check both of the lower extremities. All right. We also want to get a pulse at the feet and check for a motor and sensory response. So make sure that she could feel it, she could feel her toes, and can she move them? All right. And after that, we're gonna check the upper extremities. So we'll check both. This is the injured hand. We're gonna check for a radial pulse since she is alert, she is conscious. Then we're gonna check for sensory and motors sensation in the upper extremities also. So make sure that's okay. All right. And once we've done this, we're gonna want to right before we put her on the backboard, we're gonna want to roll her over. Make sure we check down all the way back, all the way down the spine, all the way down to the coccyx. And after that, we would get it on the stretcher, assess any other injuries we might have found, and continue to apply pressure, try to control the bleeding. And once that is all set, we want to make sure that we reassess her every 5 minutes for any changes in either the bleeding or all of her vitals, including that pulse, the weak and thready pulse, and also that low blood pressure. And I think we're done here. Thanks. Yeah.